Welcome to another NP Academy lecture. Today we will talk about azithromycin. Recently there has been new interest in azithromycin mainly because a group of doctors from France published an article earlier this month where they found that azithromycin along with hydroxychloroquine has been shown to be very effective in managing coronavirus disease. So given that, and also as a nurse practitioner, you will be prescribing azithromycin rather often, I thought this is a good time to discuss it. So azithromycin belongs to this class of antibiotic called macrolide. So macrolide is a class of antibiotic and azithromycin is one among them. Azithromycin. The other antibiotic in this class is your erythromycin and carithromycin. Now, why do we call it macrolide? Macro means big. So these antibiotics are really big in size. Just to put this in perspective, the number of carbon compound, the carbon atom in azithromycin is 38, while in penicillins is 16. So compared to penicillin, this is twice as big. So that's why we call it macrolide, because of the size. Now, how does these macrolide work, the mode of action? To know that, we need to go into the cell biology and look at the protein synthesis. If you remember correctly from your cell biology lecture, protein synthesis happens on an organelle called ribosomes. And there are two different kinds of ribosomes. They're different in prokaryotes and they're different in eukaryotes, like mammal, like me and you. The ribosomes are made up of two subunits. One is called a smaller subunit that is made up of 30S and the larger subunit made up of 50S in the prokaryote, while in the eukaryote a smaller subunits are made up of 40S and the larger made up of 60S. As a part of protein synthesis, this is your mRNA, and then tRNA. This brings the amino acid, and this is your amino acid. They bring it here, and the protein synthesis happen here, where these amino acids get linked together in a chain of peptide called polypeptide or protein. The exactly same thing happens in the eukaryotes too. What these azithromycin does is, or the macrolide in general, that they block your larger subunit. They just block it. So because of this, the larger subunits are not available, so they do not form the protein, and that's how bacteria dies. Well, so when we take the azithromycin, it kills the bacteria because they don't let the bacteria form the protein. How about the protein synthesis that happen in our body? Our protein synthesis does not get affected, and mainly because we have a different set of ribosomes. We have a 60S and 40S, while the prokaryote, the bacteria, has 30 and 50. So that's why it doesn't affect the host protein synthesis, while these antibiotics only affect the protein synthesis of bacteria. Okay. Another thing to know about azithromycin is that if you have to classify the antibiotic, let's stay with the black color here. If you have to classify the antibiotic, there are two different classes. There are multiple ways. One way is called bactericidal. This class of antibiotic usually kill bacteria right out, kills it. The other one is bacteriostatic. Static means arrest. So this class of antibiotic, they arrest the growth of bacteria. Your macrolides are bacteriostatic. It's not bactericidal, bacteriostatic. So bactericidal kills faster, but your macrolides are bacteriostatic, so it does arrest the growth, so it does kill the bacteria, but rather a little slow. Okay, so what are the bacteria that is killed by macrolide or the azithromycin in general? And one of the most common class of bacteria that can be covered by the azithromycin is your respiratory tract bacteria, the bacteria that cause the respiratory problem, and these are Streptococcus pneumonia that cause the pneumonia, you all know, Streptococcus pyogenes that cause your strep, A, B, C, different classes called strep pharyngitis, Haemophilus influenza, this cause pneumonia, more common among COPDers, Moraxella catarrhalis, Staphylococcus aureus, those are your, especially the MSSA methicillin sensitive Staphylococcus aureus that cause your skin infection. And then azithromycin also cover some of your atypical organism, and those are your mycoplasma pneumonia. Your other one is the chlamydia pneumonia, legionella pneumonia. These are your atypical bacteria. So what are these bacteria? What are the diseases that is caused? Most of these bacteria cause either upper respiratory infection or lower respiratory infection. So most of these bacteria cause your pharyngitis, but most common is the strep pharyngitis, this one, sinusitis, otitis media, conjunctivitis, and then the lower respiratory tract infection, that's your pneumonia. And pneumonia is also caused by your atypical. And one of these days we'll talk about pneumonia in more detail. So these are the common bacteria that is covered by azithromycin. So what are the use of azithromycin? The most common use of azithromycin that we use is in the pneumonia. If it's an atypical bacteria, then we only use, if it's an atypical pneumonia, we only use azithromycin. However, if it's a typical pneumonia, then we use azithromycin along with the class of penicillin like augmentin or the cephalosporin. The typical dosing pattern for azithromycin is your 500 milligram on day 1 and 250 milligram on day 2 through day 5. So total of 1 gram over the course of 5 days. Now why is that? If you remember correctly, most of the time we use antibiotic for 10 days and sometimes we use twice a day, while azithromycin has a very simple dosing, 1 time a day only for 5 days. And the reason is half-life. Half-life of azithromycin is almost 60 hours. So what they found is that if you give them 1 gram dose of azithromycin over the course of 5 days, this will stay in your system for almost 10 days, mainly because of the longer half-life. So that's the beauty of azithromycin. Other thing to know about the tissue distribution. That's very important. As a nurse practitioner, whenever you are prescribing the antibiotic, you need to understand, does this particular antibiotic will cover that particular tissue? For example, if you are prescribing the antibiotic for meningitis, you need to know, does this antibiotic cover and cross the blood-brain barrier and will go to the brain? So they looked at the tissue distribution of azithromycin, it well distributed throughout the body, but they found is that azithromycin particularly have a very high concentration in lung tissue. In lung, compared to plasma, they have almost 100-fold more concentration in lung tissue. So that's the reason when we treat the atypical pneumonia, with azithromycin or community-acquired pneumonia with azithromycin along with penicillin, the reason we use azithromycin is because it's a really high concentration in lung, almost 100-fold compared to plasma. It stays in your system for a long time, almost 10 days, and has a very simple dosing regimen. And as I said, cover atypical and typical. So that's the most common one. Okay, how about these conditions? Why don't we use azithromycin in these conditions? The fact is that you can use it, but we don't use it as a first line of drug, and mainly because azithromycin is a bacteriostatic. So we prefer to use bactericidal, and we prefer to use for this condition as a penicillins. But at any place where we cannot use penicillin, we can use azithromycin. That's a one simple rule of thumb. Other place that we use azithromycin is to treat your STD. So one of the most common cause of STD is your chlamydia trachomatis. And to treat the chlamydia, we give again 1 gram dose of azithromycin PO one time. Once is azithromycin. Now, you can treat chlamydia with doxycycline, but this dosing is 100 milligram PO BID for 10 days. So because of this, here you have only one dose, one time, and the fact that it has a long half-life, it will stay in your system for 10 days, we use azithromycin. Other use of azithromycin that the macrolide is your this one, erythromycin. So erythromycin we use all the time, erythromycin to manage conjunctivitis. The usual that medicine come in the 0.5% ointment, and we use almost ½ inch in the eye 4 times a day for 5 to 7 days. It works like magic. So that's the most commonly used of erythromycin in the conjunctivitis. The clarithromycin, also called Biaxin, the most common use that I have used is in the H. pylori induced gastric ulcer. H. pylori gastric ulcer. And the dose is 500 milligram BID for 2 weeks. I will talk about more details when we talk about the H. pylori ulcer. So these are your most common macrolide, including azithromycin. Now, what are the side effects of it? So just like any other antibiotic, the side effects are nausea, vomiting, diarrhea, abdominal cramping, and this you can manage by taking this medicine with food. Okay. The other serious side effect of azithromycin is your QT prolongation. So who are the patient that will be more prone for this condition, QT prolongation? Is the patient who has a history of QT prolongation. That's a big one. So you have to be very careful to prescribing those patient who are on the amiodarone, like any antidysphotic drug, sotalol, on the patient who has a history of torsade, patient who has a history of bradycardia, who has a history of hypomagnesemia, hypokalemia. So these are the patients, those will be more prone for the QT prolongation. So you have to be more careful when you prescribe this. So this is all about azithromycin and macrolide in nutshell.